Hello and good morning from Malibu. I have been invited to stay here at the Malibu Country Inn, which is so awesome because it's not too far from where I'm getting my tummy tuck, which is tomorrow. Like, I don't know where the time has gone. It's disappearing on me, slipping through my fingers, but that's okay. I'm getting really excited. Everything is officially ready to go, and now I'm just waiting for Ethan to get here. We're gonna be picking it from LAX soon. He's actually on the plane right now. But yeah, anyways, I just wanted to take some time to show you guys where we're staying. We are here at the Malibu Country Inn, like I said, and this is the mountain view room. So we definitely have some scenic views coming up, and we are so close to the beach. If you just like go past this area, the water is right there. We can literally walk to it. So I will show you guys all around the room, and I'm just so happy to be here. So yeah, this is our room here at the Malibu Country Inn in the mountain view room, and I'm just really grateful to have a place to come and just prep for my surgery before the night before, and then come back to just in my time of recovery. I wanted to be able to stay somewhere pretty close to my surgeon's office because I have to report back to him the day after my surgery so we can do some bandage changes and just check up on everything. So really grateful to be here, and the purpose for today's video is to show you guys what I'm packing for the day of surgery. So we're gonna do a what's in my surgery bag video for this episode, which is number 9 of Journey to Tuck. So yeah, let's just get right to it, and I'm gonna unpack and show you guys everything I brought with me. So first things first, I brought the folder of all the paperwork that I've been given by Dr. Kerendian. These are just instructions, you know, things to do for prep, the rules, you know, don't have any alcohol, don't eat 8 hours before your surgery, all that kind of stuff, you know, all the fine details, everything in writing on surgery date and timing. Just wanted to make sure I'm prepared and have everything that he gave me here with me. Now, for the morning of my surgery, he told me to come wearing something really comfortable, like so no jeans. So I'm thinking, I brought a couple options, but I'm thinking what I'm gonna do is this pair of Victoria's Secret joggers I have. They're actually, I've had them for a while. They're a size large, so they are a little bit loose on my waist. So I think that's gonna be good considering when I put them back on later, I don't want any pressure from my jeans or anything. So joggers I think will be really nice and comfortable. And I just brought this little like black cami top to pair with it, something comfortable on top. It's really stretchy. I am a little worried that I might be cold, so I brought a jacket as well. So yeah, joggers, a little tank top, and some of my Nikes. Keeping it really simple, really comfortable. Now for after the surgery, I know anesthesia can sometimes make people really cold, so they told me to bring warm clothes. So I brought slippers, that way it's just easy, and my Ugg slippers are really warm and cozy, and I think they're gonna be perfect. I also brought a sports bra just in case. I don't know if I'm gonna want to change into that. And I brought this little pink sweater I have. It's just a really comfortable crew neck sweater. I don't know if I'm actually gonna end up wearing it because I know that it might be easier for me to wear things that have buttons or zippers. So I have this just in case. And I also have a jacket that zips in front in my car in case I need it. What else? I brought a bra and underwear as well. So when Dr. Kerendian is gonna prep my body for the surgery, he's gonna use his surgery pen and like do all the markings, and I'm gonna be in my robe and a bra and underwear. So I just wanted to make sure that I have some undergarments to be wearing during that time. I brought a pair of long, thick socks because I tend to be really cold and I just want to make sure I'm prepared if I want them. Now, as far as after my surgery goes, I brought some special pajamas. A lot of people, like I said, recommended doing things that open up in the front, so with buttons or zippers or robes. So I found this really comfortable material nightgown from Target. And honestly, it's really cute and I'm really excited to wear it because I love long sleeves, but it's really warm. I think it'll be really great for my recovery. Okay, so then I also found a 2-piece pajama set. These are some little shorts. They're just like cotton, comfortable material on the waist with a button-up front shirt. These were from Ross. They came together. And yeah, the buttons up, I think that'll be really good because underneath all my pajamas, I'm gonna have to wear one of those fajas, like the full body girdles, which Dr. Kerendian is providing for me, and he's gonna be giving it to me tomorrow. The back says, do not disturb. I don't know, they're just cute. They were from Ross, really good deal. And I also got this robe from Ross. A lot of people were saying that it's easier to just put a robe over the faja because it's just like easier access, and you might not even find it necessary to wear clothing sometimes. So something like a robe where it's like more of the purpose of just covering up your girdle, then yeah. Yep, so I got this cute little robe for like 12 bucks at Ross, and it's a really comfortable, cozy material. Like it feels like a pajama material, so that will be really nice. Oh yeah, and then I also found these pajama pants at Target. These ones just have a really comfortable, loose waistband, and the material is really soft. Who knows, I may or may not wear them, but I just wanted to make sure I was prepared. And then to go with it, I brought another one of my little white stretchy camis. It's kind of like a sports bra slash tank top. They're really comfortable and I sleep in them a lot, so. What else? Oh, this is kind of fun. So for tonight, the morning before surgery, I tend to like get a little stressed out sometimes, and like I have to do things like the little me things, like just, you know, take care of yourself, relax, don't stress. So I thought it would be fun to bring a bath bomb. I don't know if I'm actually gonna get around to being able to take a bath, but it sounds like a really nice idea. So I got one of the bath bombs from Lush, and if you guys have never used these, they're so fun. They like color the whole water, and look how cute this one is. It looks, oh well, it kind of broke a little bit, but it's the peach emoji, so it's just super cute. Maybe I'll get around to it. I definitely feel like I could use a little relaxation, which leads me to the next thing. Something else that always relaxes me, face masks. My boyfriend Ethan got me like a handful of face masks, and I'm like pretty much set. So he's here with me. I might make him do it with me. Not that he would complain because he loves face masks. So yeah, face masks, bath bomb sounds great. With that, I got my hairbrush, so I'm ready to go in the morning. I was instructed not to come wearing any makeup, so I'm just gonna make sure that my hair is nice and like dry. I'm gonna shower, but I want it to be dried and brushed out. I won't be wearing any makeup. I brought my favorite ever chapstick. I had to finally rebuy one because I actually went through it all the way to the end, which never happens with chapstick. But this is my favorite chapstick, and for the last 2 surgeries that I've had to go through, I don't know why, but my lips and my mouth just like inside gets like really dry, so I'm just like, okay, we need something like this. So definitely a necessity. Toothbrush, toothpaste, obviously. Moisturizer. I'm a big moisturizer person. If I don't wear it, I feel like I can't move my face all the way. Face wash, yes. And oh, this new set, just lotion, body wash, a little perfume. I don't know, I probably won't wear the perfume because who needs that like for the surgery, but it's a set, so why not bring it all? And deodorant. What else? Oh yeah, and then some wipies. I got these ones. It's for sensitive skin. I do tend to have sensitive skin, but I thought it was a good idea considering this is for a surgery, and I'm not going to exactly be able to like shower right away, but having wipes just to feel fresh and clean, just to use anywhere on your body is definitely a nice idea. And a lot of people recommended using a neck pillow when it comes to recovery, so I have this packed with me ready to go for even just the car ride back to my hotel after the surgery. So yeah, I got this from Ross. It was like $7.99. I'm really stoked. It's cute. Really glad. I also brought this. Now my friend Cameron, his mom Tammy, she's basically like a mom to me as well. Her friend went through a tummy tuck procedure as well and had this. It's a little thing that you can wrap around your waist and it holds the drains. And I just think that that's really cool because a lot of people talk about how like when you walk around you have to carry them. But if I just tie this around my waist and put them inside, I feel like that's gonna make things so much easier. So thank you so much, Tammy. You are so sweet for lending me this. I'm really excited to use it. I think it's gonna be really helpful. Now, let's talk medicine. And I'm actually gonna switch parts here with my boyfriend Ethan. He's in school right now for nursing, and he's been a part of like the medical field for like the last 5 years. So he is better at explaining medicine, and he like knows actually the reason why Dr. Kerendian prescribed me certain medicine for my recovery. So I'm just gonna switch spots with him, and I'm gonna record, and he's gonna tell you guys about the medicine that Dr. Kerendian prescribed me.
What's going on, y'all? So like Desiree said, my name is Ethan. I'm her boyfriend. If you don't know that, where you been? But I am a nursing student currently. I'll graduate in May as an RN. And I've been working as a pharmacy technician for the last 3 years almost, and I've worked in the emergency department and had several jobs in the medical field. So I'm super proud of her and super excited to be able to be here and to be able to play nurse for her and listen to her cry. I mean, and help her heal. But yeah, it's gonna be a lot of fun. And so I'm gonna go over the medications that Dr. Kerendian prescribed her. Doctors prescribe different medications for every patient. There's different, needs, different things that are taken into consideration. So if you're going through this procedure, the doctor may give you more stuff, may give you less stuff, may give you different stuff. This is not the one prescription for all tummy tuck patients, so just take that into account. If you're having one, you may not get the same stuff. So what we got, she has her thyroid medicine. Talked to her anesthesiologist. She is good to take her thyroid medicine. As you know, if you follow along with her story, she does have hypothyroidism. So she is still good to take this on a very small sip of water in the morning. You can't drink, you have to be NPO, which is nothing by mouth, for 8 hours leading up to surgeries, just because you don't want anything in your stomach, because it could cause regurgitation, or you could asphyxiate basically and choke. And then she has the pain medication. This one is an opioid, it's generic for Vicodin, hydrocodone, and Tylenol. This one he gave her, this is going to be for like the major pain. This one's going to be definitely the first couple of days to kind of help keep her functioning. So this one's going to help hopefully keep her a little bit sane, and at the very least it's going to knock her out and make her sleep so she's not yelling at me, so that's good. The next one is going to be the DocuSafe. This is Colace. What Colace is, it's a stool softener. The hydrocodone is known, they slow down your GI tract, it slows down your stomach, and actually can cause constipation. So what this is a stool softener. It basically draws water into the bowels and helps the stool not get clogged up, not clog up your bowels and cause constipation. This is also really helpful because since she is having a tummy tuck, you don't exactly want to have to bear down or push or put pressure on it if you are going to the restroom. So what this is going to do is help kind of promote an easier time going to the restroom. I'm trying to think how to word it. If you're not no medical background, try to word it so it doesn't gross you out. But this is going to help keep her out of pain and keep her from getting like a bowel obstruction or anything like that, because that is the last thing you want to deal with whenever you're healing from a tummy tuck. And then this one, I believe, is cephalexin. Keflex is an antibiotic, and this one is going to be to help infections. She may start taking it tomorrow when we get home. I'm not sure. They're going to give her IV antibiotics tomorrow, I'm sure. And then she'll potentially start this the day after. I've got to talk to him tomorrow. So this one she's going to take 4 times a day until they're gone, 10 days. It's very generic, typical antibiotic dosage. And this one she'll be taking to help prevent any kind of skin infections, any kind of sepsis, any kind of like just, you know, infection. Because nobody wants to run into that. And then vitamin C drops. I don't know why exactly she got the vitamin C, but she was recommended to do like lozenges, like throat lozenges. You know, when you laid up in bed after surgery, like she had talked earlier, her mouth gets dry, her lips get dry. These are just really good to kind of have on hand. The Arnicare gel, this one is like a topical gel that is used to help with like pain relief. She had, I believe, 2 or 3 people recommend this for the pain. This one she probably won't use until it starts closing up. You don't want to put this on a fresh wound, but definitely check with your doctor, run it with your doctor. I am going to check with Dr. Kerendian tomorrow on this just to make for certain. Every doctor likes different things, and he may not want her to use this, and we don't want to cause any complications that he didn't want her to have, so, you know, cover ours. But yeah, that is going to be my drug cabinet of the night, and that's going to be everything. Like I said, I'm super excited. I'm super, super proud of her, and she's honestly incredible, and nobody deserves this more. And I cannot wait to see the new levels of confidence and the new levels of just being herself that she's able to reach with this. I don't know, I'm really excited to see this, and y'all think y'all seen Desiree. Now you haven't seen anything yet, I promise you that. Yeah, y'all stay tuned. I'm gonna get back behind that camera where I belong and put her over here. And I think she's gonna go over some food things that she packed. I'm gonna be using a lot of Postmates and Uber Eats.
Okay, so now as far as food goes, I did pack a couple goodies. First of all, I got these little rice kits. They're kind of like mini rice cakes, and there's 4 different flavors from here. Ethan's with me, and he likes to snack on them too, and I just thought that these would be like really good, easy, simple snacks to have while I'm here. Something also easy and my favorite protein bar ever is the Almond Bliss One Bar. These are my all-time favorite, so I had to pick up a pack of these. My friend Brenda, she recommended me pineapple juice to help with the swelling, and then I actually ended up hearing that from multiple other people too, so luckily I got some of this. Hopefully that'll make for a smoother recovery. If any of you guys know anything about me, it's that I love Chobani flips. So I got Ethan's favorite, which is the key lime, and my current favorite, the s'mores. But I also love the almond cocoa loco. But this is a 4-pack for like $3. Could not beat it. And then everyone is recommending electrolytes after surgery. So I got some Powerade and the Gatorade Zero. Ethan told me about the Zero, so no sugar. And then yeah, some Powerades. Lastly, my Hydro Flask and my little Yeti cup that says Desi on it. These just really keep all my drinks like ice cold, and I pretty much anywhere I go I have at least my cup or my Hydro Flask on me. That way I'm constantly just drinking water and staying hydrated. Okay, so last but not least, I brought my pillow and a little throw blanket because when I'm driving home after my surgery, apparently the car ride is going to be really uncomfortable, and anesthesia makes you cold, I guess. So yeah, just try to be prepared as possible, but yeah, that's pretty much it. I'm definitely feeling really prepared, and thankfully I got a lot of advice and tips from people who have also undergone this surgery. So thank you to everyone who has answered all of the questions I've been asking you on what to pack in this surgery bag. So yeah, I'm feeling really prepared. I still cannot believe that my surgery, my tummy tuck, is happening tomorrow. There's so many emotions. Like, I am so thankful for all of you guys who have been just sending me such encouraging messages all day today. They are flooding my phone, and I cannot thank you enough. I am feeling so ready, so pumped, and so ready for this next chapter of my life. And I just thank you guys so much for following along with this journey. We've all been on the countdown for this day, and I just cannot believe that it's already happening tomorrow. So again, thank you guys so much for watching this video. While you're thinking about it, go ahead and like this video, subscribe to my channel so you can keep up with the next Journey to Tuck episode, and hopefully soon enough you'll be able to see my results. Okay, so side note, I'm also going to be packing my new AirPods, when we were at dinner, Ethan and I picked him up from LAX and we went to sushi, and he surprised me with my very own pair of AirPods. And this just means more than you guys can know because we live on FaceTime and we are both busy people. So me constantly walking around with my phone up here, my phone right here, listening, it's really difficult. And so these are gonna be such a game changer, and I'm so excited. So thank you. So yeah, these are definitely going in the bag.